Now, stem cells can be a great option for the treatment of erectile dysfunction, but that leads me to treatment number 9 for the treatment of erectile dysfunction, and that's using exosomes. So what exactly are exosomes? Exosomes are what they call microvesicles or nanovesicles, and they're actually part of the stem cell. They come from the stem cell. So what I was talking about just a minute ago, bone marrow and adipose, Wharton's jelly, amniotic fluid, all those stem cells carry their own exosomes. Exosomes is basically the messenger, the chemical messenger, and they're responsible for traveling throughout looking for cells that are faulty. Maybe cells that are inflamed or not doing their job, zombie cells. And what they're doing is they're putting their own code back into that cell to tell the cell how to work again. The nice thing about exosomes is, like I said, it's a nanovesicle or a microvesicle, so it's very small. So it doesn't do the clumping the way that the stem cells do. But it also doesn't carry the genetic material that stem cells do. It does not have DNA material in it. It only has messenger RNA and microRNA. So, sometimes patients become a little bit weary about taking stem cells because they're getting genetic material from somebody else that they don't know. And with exosomes, you don't run that risk. So the pros to using exosomes is very similar to stem cells when you're adding it to your PRP for an injection, a P-Shot injection into the erectile tissue, is the growth of the tissue. You're exponentially growing that tissue and the blood vessels and the nerves that go with it. So, what we notice here at the clinic is patients see enhanced results very quickly as far as erectile dysfunction. I just got off the phone with a patient earlier today who told me that he's able to have multiple sessions in one day, whereas before he couldn't. And he's able to maintain this firm erection for all encounters. He's having morning erections, spontaneous erections. The other thing that I'll hear from the guys here at our clinic is they'll notice an increase in size, both with girth and length. Now again, that's not everybody, but that is something that we commonly hear at the practice. The other pro to using exosomes is, again, it doesn't contain genetic material. There is no DNA in it. It's only messenger RNA, which is the messenger, the chemical messenger that's bringing all the information to your cell. So you don't have to worry about where this came from and, are you going to get someone else's genetic material? Because that's just not the case. It's an exosome. It just is that vesicle that contains that information. So those are the pros that we see here at the clinic. So what are the cons to having an exosome P-Shot? Very similar again to stem cell P-Shot. It's an injection. So, we still do have to give you a lidocaine block. Again, I'm not injecting the lidocaine block into the penis itself. It is into the suprapubic region. I'm looking for that dorsal nerve, but I still have to give it to you because it is an injection. And just like all injections, you do run the risk of having any kind of bleeding or swelling or bruising, but this does heal within a couple days, so don't worry about that. The other thing is an exosome P-Shot is expensive because you are getting these exosomes from placental tissue. So again, it's a donated placenta that they had to take the cells from and regrow. So it's a process that happens. It's not as cheap as just pulling your blood from you. So I have lots of patients who ask me if there are any side effects to the Exosome P-Shot, and I'm happy to report that here at Novus we've had 0 side effects, 0 adverse reactions to the actual Exosome P-Shot. Besides, of course, the actual injection, because you are using a needle. So you can have a little bit of bruising or bleeding or swelling, but again, that will subside within a couple days. But I'm happy to report that there are no adverse or side effects to the Exosome P-Shot.
If you'd like your own personalized treatment plan to help treat your erectile dysfunction with step-by-step instructions of what to do and when to do it, just go to getmyprotocol.com.
We've left clinical studies to the topics we discussed in the description below. We hope this video helps.